All right, if you're out there and you have tried to implement remote therapeutic monitoring into your practice as a provider and you failed miserably, this video is for you. My name is Dr. Andrew Gorecki. I'm a physical therapist. I own outpatient private practices, and I'm also the owner of MovementRX, which is the best remote therapeutic monitoring software on the market. I have implemented remote therapeutic monitoring on my own in my own practice, and I've also helped hundreds of practices around the country do this as well. And I hear a theme that's very common. Most of the time it goes like this. We introduced remote monitoring. We got the software from one of the big corporations that are out there that offer remote therapeutic monitoring. A lot of times it's the company that's affiliated or attached to our EMR or electronic health records. So it was there, it was available, it was easy, we just went with them. And I'm disappointed in what's happening. My therapists don't seem to be super excited. Patients don't really like using the software. It's not easy to use, and it's just not going well. And I'm paying this service for the next 8 months, monthly, and we're not really generating any revenue, and also it's not really making an impact on our patient outcomes or engagement. That story is happening more and more as we enter this new world, this new opportunity for physical therapists, speech pathologists, occupational therapists, pain management physicians. And I can tell you that the number one reason why that's happening to you is not because remote therapeutic monitoring is a bad idea. It's because you chose the wrong company to work with, right? You have a corporation that just sold you software, and they're not there to really walk you down the path and essentially hold your hand and teach you how to overcome all the challenges that are out there, from billing to engagement to therapist buy-in. I've gone through all of that, not only personally in my own practice, but helping all these other practices. I can tell you that that's what's happening, right? We went to our providers really early on in 2022 and said, all right, guys, we're gonna do this new RTM thing. We've got the software, we already make home programs, it's gonna go great. The first thing they said to me, they pushed back immediately and said, we don't have any time for that. We're busy, we have a 6-week waiting list. We're full, we're seeing 60 plus patients a week individually. We just don't have time to monitor patients' activity and engagement outside of patient care time. And that was the aha moment that I had, where I realized right away that I needed to hire a remote provider, somebody who is only doing this and it's their main job, and they're actually not even in the clinic, right? They're not distracted by our day-to-day. They're working remotely, they're doing this online, and that's really the benefit of working with MovementRX. We have a nationwide group of remote providers, physical therapists, physical therapy assistants, OTs, OTA. Creates the home program like they're used to doing, hopefully, and then everything else is done in the back end. The patient engagement increases, the patients are happy, they always have someone to talk to, they can chat back and forth, and messages actually get answered. The team supports you in billing and getting reimbursed for these codes, and life is good. And so if you're frustrated with the corporate RTM companies and you haven't had a good experience with RTM, don't give up yet. I would encourage you to reach out directly to me. We can have a conversation about what it's been like and how we might do it differently in the future. Hope you enjoy listening, and we'll talk soon.